Hi everyone. This is for quiz 4 of top 200 drugs. This week's topic is endocrine. All right, so the first drug is ramipril or brand name Altase. It is angiotensin converting enzyme inhibitor, often called ACE inhibitor in abbreviation. So angiotensin converting enzyme is an enzyme that converts angiotensin 1 to angiotensin 2, which is a hormone that is very potent vasoconstrictor, which means that it constricts vessels that can lead to increase in blood pressure. So by inhibiting this enzyme, angiotensin converting enzyme, this medication ACE inhibitor lowers blood pressure. Very effective in lowering blood pressure, but it also has a lot of evidence for kidney protection and heart protection. So it is the medication that we give to every patient after having heart attack and also patients with heart failure. And it is a drug of choice for antihypertensive treatment in patients with kidney damage and also patients with diabetes. So I will cover other drugs in this class, ACE inhibitor, in other weeks, and this is really commonly used in our patient population. So calcium carbonate, basically it's a calcium, which is a mineral. There are many different forms out there, but we're going to mainly look at Tums, which we see often in over-the-counter aisle in the pharmacy. So it is antacid, so it can be used for calcium supplements, but mainly use it as an antacid, or it can also be used as hyperphosphatemia in patients with chronic kidney disease. So we're not going to really go into that, but basically calcium carbonate, it is basic, so it turns acidic stomach environment to neutral pH. So by doing that, it suppresses the symptoms of heartburn. Potassium chloride, brand name Chlorocone, is basically electrolyte supplementing potassium when patient has low potassium or hypokalemia. Gabapentin, brand name Neurontin, is very commonly used medication that is in the class of anticonvulsant. So it can be used for treating seizure disorder, but it is more used for nerve pain or neuropathic pain. So it has a FDA label indication for post-herpetic neuralgia, which is having nerve pain after having shingles. But it is more often used for diabetic neuropathy off-label. Pregabalin, with brand name Lyrica, it is very similar to gabapentin, the one that we just talked about. It is more potent than gabapentin, but remember this is controlled substance, so it is in control Schedule 5, whereas gabapentin is non-controlled. It has a little bit more indication than gabapentin. It has indication for, of course, seizure disorder because it's in class of anticonvulsants, but it also has indication for fibromyalgia and neuropathic pain. So metformin, brand name Glucophage, in class of biguanide, it is very commonly dispensed medication. If you work in pharmacy, you probably see metformin a lot. It is first line agent for type 2 diabetes management, which means that this is the first medication that patients with type 2 diabetes, so not type 1, so it's just for type 2, they're going to get, this is the first drug they're going to get when they have diabetes. So it is classified as insulin sensitizer, which means that it increases insulin sensitivity in liver and muscles. So it helps to patients to utilize insulin what they have, or even if they get insulin exogenously, it helps to be able to utilize insulin more. So remember, you learn later in therapeutics that type 2 diabetes, one of the main mechanism is having insulin resistance. So metformin is a really important drug. It is a first agent. It's something that will be kept until a patient really cannot take it anymore mainly because of renal failure. So really commonly used drug, very important medication for treating type 2 diabetes. So glyburide, so we're gonna actually look at three medications that are in the same class. So remember, so glyburide is a brand name Diabeta in class of sulfonylurea. So next three drugs we're gonna talk about, they're all in the class of sulfonylurea. So remember in the quiz, I like to group medication in the same class and ask that way. So remember these three drugs that I'm gonna talk about, they're in the same class. So this is also for treating type 2 diabetes. Um, Basically, there's a receptor. So remember that our body has pancreas that's secreting insulin. So there's a receptor called sulfonylurea receptor on the beta cell. That's where this medication binds to that stimulate pancreas, more specifically beta cell on pancreas to secrete more insulin. So this type of medication is categorized as secretagogue because it secretes insulin, whereas remember metformin was insulin sensitizer. So it is one of the really old drug, very cheap, very easy to use. It's oral tablet. However, it has a lot of side effects, mainly causing weight gain and hypoglycemia or causing low sugar because how the drug works, secreting insulin, it works in glucose independent manner, which means that it works without have anything to do with your meal intake. So even if the patients didn't eat anything, the medication will still stimulate insulin secretion, so it can cause hypoglycemia. So glyburide actually has a highest risk for hypoglycemia because it's really long acting. You take only once daily. And also there's active metabolite, which means that there's a metabolite, even after going through metabolism, there's something active that stays in your system that works actively. So glyburide actually has the highest risk for hypoglycemia. It is on Beer's list, which is a list that of the medication that should be avoided in patients who are elderly. So patients who are older than 65, this medication should be avoided. So glimepiride, that is another sulfonylurea in the same class as glyburide that we just talked about. The brand name is Amorel, also used for type 2 diabetes, another secretagogue. It is a little bit safer than glyburide because it still is a long-acting medication, but it doesn't have the active metabolite. So a little bit better than glyburide, but still has pretty high risk for causing hypoglycemia. So next one, glipizide. Probably this is the one that you see most often at the pharmacy. Brand name Glucotrol. Another sulfonylurea. The reason why this one is the most commonly used is because it is a short acting, so you have to take it twice daily. However, because it is a shorter acting, it has a little bit less risk for hypoglycemia. So if really we have to use this class of medication, glipizide is the safest, safer option than other ones such as other ones that we just talked about, glimepiride or glyburide. All right, so sitagliptin, or brand name Januvia, is another medication for diabetes. The class is called dipeptidyl peptidase 4 inhibitor, or we may usually call it DPP4 inhibitor, also used for treating type 2 diabetes. So DPP4, it is an enzyme that breaks down really important hormone in our stomach that gets released when we eat meal. That gives sign to our pancreas to secrete more insulin, and also talking to our liver to suppress the process called gluconeogenesis that produce glucose from other things like protein or fat. So this is really important drug. So by inhibiting the enzyme that breaks down that really important hormone, it works that way. It is not as potent medication, so it is not really the one that we go for, but this is oral tablet. It doesn't really have a risk of hypoglycemia, just like other ones that I talk about, sulfonylurea. So it is not really much popular now as there are many other options we have as available. All right, insulin glargine, brand name Lantus. It is long-acting insulin, can be used for both type 1 and type 2 diabetes. So recently they came out with another brand name called Tuzeo. You probably have seen it in the pharmacy, which is a more highly concentrated version of Lantus. So there are two different types of insulin, long-acting insulin and short or rapid-acting insulin. That's how our body produces insulin. So this is replacing long-acting insulin. Um, um, so there are many other ones available, but Lantus is one of the most commonly used long-acting insulin in the market. All right, pravastatin, brand name Pravachol. It is another HMG-CoA reductase inhibitor used for dyslipidemia and prevention of coronary artery disease. So we talk about another HMG-CoA reductase inhibitor in week 1, lovastatin or Mevacor. So remember that we now learned two HMG-CoA reductase inhibitors, mainly called as statins. So pravastatin is another kind of low to medium intensity statins that are not commonly used anymore because they're kind of like not as potent than other ones that are available. So this is another statin. All right, escitalopram, or brand name Lexapro. It is selective serotonin reuptake inhibitor, or SSRI. We kind of talked about it in last week. It is used for depression and also can be used for generalized anxiety disorder. So remember we talked about citalopram or brand name Celexa last week. So as citalopram, basically it is very similar to citalopram. So citalopram molecule actually has two different enantiomers. There's a R citalopram and S citalopram. So basically there are two isomers that are in citalopram. So basically escitalopram is just the S enantiomer of citalopram without R enantiomer. So because they found out that escitalopram is the one that really makes all the effect of its antidepressant efficacy, but R is the one that can cause side effects. So they made it more pure version of just escitalopram. That's what Lexapro is. Paroxetine or Paxil is another SSRI, very similar to other SSRI used for depression and generalized anxiety disorder. Actually, paroxetine is not as often used compared to other ones because it causes more drowsiness, weight gain, and some other side effects. So not really preferred version, but because it causes drowsiness and a little bit of sedation, sedative effect, it is actually has more calming effect than something more activating like fluoxetine we talked about last week. So it can be used for patients who have depression and more anxiety. Sertraline or Zoloft, it's another SSRI. So now we learned several SSRI. We learned fluoxetine, citalopram, paroxetine, and now sertraline. So these are all, sertraline is used for depression. It can be used for OCD and also panic disorder. So it is one of the really commonly used SSRI as well. Alendronate with brand name Fosamax. It is in class of called bisphosphonate. It is a first-line agent to be used for treating osteoporosis. So osteoporosis is basically having weak and fragile bone, mainly happening in women going through menopause or postmenopausal women because not having the estrogen after menopause, that's when we start having weakening bones. So it works by inhibiting bone resorption, which means that it is inhibiting the breakdown of bone. Levothyroxine, you probably see a lot, brand name Synthroid. It is basically replacing thyroid for those patients who don't have enough thyroid hormones. So it is a synthetic thyroid hormone for treating hypothyroidism. Argocalciferol, or it is vitamin D2. So it's a class of vitamin D analog used for vitamin D supplementation or treatment for vitamin D deficiency, or it can also be treating hypothyroidism. So we need to make sure, I'm not going to ask you in quiz, but we need to differentiate between vitamin D2 and vitamin D3. So D2 is argocalciferol, whereas vitamin D3 is called cholecalciferol. So cholecalciferol actually has longer half-life and higher potency, so that actually should be preferred. But and that's what our body naturally produce. Whereas vitamin D2 is actually synthetic manufactured vitamin D analog that is not as effective, but because it was easier to manufacture vitamin D2, it is more commonly used in practice. Alprazolam, or brand name Xanax, it's another benzodiazepine. So we covered several benzodiazepines in the past weeks as well. So try to remember all the benzodiazepines you have learned. Also used for anxiety and panic disorder, and also can be used for seizure. Chlorhexidine gluconate, its brand name is Peridex, and it is topical antibiotic. So it comes in liquid. So it is something that you can use as a mouthwash. Also, it can be used for cleaning agent before going into surgery. So for pre-operative skin cleaning. So use in dental practice for patients with gingivitis or periodontitis. So patients who have all these dental issues, or after or before going through the procedure, this is something that dentists often prescribe for their patients. So that's it for this week. So hopefully this video helps you in learning the drugs and kind of help you in a way that how you can memorize these drugs. And also, I actually moved around some of the order that what's in Excel spreadsheet to kind of like make the flow go better. So if you have any question, feel free to email me, and also stop by my office in the afternoons. Bye.